Hi guys, it's Tim here from cleverbodybuilding.com, and today we're going to talk to you about how to solve some common injuries bodybuilders get in their training. And today we've got Tommy. Hi from Tom.
How you doing, alright?
From Tommy under Sports Therapy and Rehabilitation, and to go through some exercises to solve that. And we've also got Skeleton Steve. Hi guys, and he's going to show you a little bit of stuff in the anatomy area too. Alright, here we go. Okay guys, so the first major problem we get, shoulder problems. I've had plenty in my time, so Tom's going to go over a few issues of why we get them. Okay? What were yours, Tom?
Fire away. Alright, so the first one is the shoulder. Typical shoulder problems that people have is at the front of the shoulder, right here. It's mainly classed as subacromial impingement. So there's a couple of things that I normally see with this, and it's a rounded shoulder look. So when you've got a rounded, protracted shoulder, it can cause a number of problems within the shoulder joint. And a lot of people that I see that train downstairs in the gym are overworking their pectorals and getting too tight in the pecs, and this is in turn rotating the head of the humerus internally like this, because the pec attaches at the shaft of the humerus. So what he's doing is rotating the arm, the upper arm inwards. That's one of the things it's doing. The deeper pectorals, the pectoralis minor, which attaches at this coracoid process here, he runs down to rib 3, 4 and 5. You can see him better on this diagram just here. So you can see the coracoid process, and you can now see the pectoralis minor coming across onto the rib. But yeah, the origin is at the coracoid process. So yeah, so what happens if you get a bit of tension in the pectoralis minor? This coracoid is going to get pulled anteriorly, and it's going to round the shoulder and the scapula, the shoulder blade. It's going to pull it to the front. Okay, so training your pecs is good, but you've got to counteract it by working on the back muscles, especially the rhomboids and mid and lower trapezius. So anatomically, what actually happens within the shoulder is, can you see this big lump here? What happens when your shoulder protracts and rounds to the front? When you suddenly try to elevate the shoulder or flex the shoulder, this lump has got potential of impinging certain structures underneath this bone here called the acromion, hence the name subacromial impingement. Structures like the supraspinatus, which is one of the rotator cuff muscles that originate here and run underneath the acromion, attaching at the head of the humerus. He's one of the muscles that is very commonly impinged, and it's a real problematic muscle. If you repeatedly impinge that muscle, you can develop tendinopathies, so tendonitis, inflammation of the tendon, or even tears in the rotator cuff, and that can be very problematic, and even in some cases in need of surgery. So that's number one. Then the bicep tendon also attaching here, the short head of biceps coming along that way. He's another muscle that can another tendon that could potentially be impinged with this forward rounding of the humeral head, all right, or the humeral shaft as well. So on a whole, there's a lot of potential injuries there coming from this anterior protraction of the shoulder. So what do we do about it? Okay, so the first thing we do, we got to stretch the pecs. This one's the PEC Stretch. We're going to use a corner today, and we're going to use Tim.
Hi guys.
He's going to be the dummy today.
I am the dummy.
So what I'm going to ask Tim to do is just place his hands across there, so slightly underneath shoulder level, and then feet together, please, Tim. And what I want you to do is posterior tilt the pelvis. There we go. So if you had a tail, he's tucking it between the butt cheeks. And now, can you please just walk into the corner, nice and slowly. Imagine there's a chain at the front of your chest, and it's pulling you towards a corner of the room, all right? Remember not to arch your lower back too much, so keep tilting that pelvis back, and it's this part of your back you're pulling towards the wall, yeah? Can you feel that, Tim?
I can, yeah.
You should feel a big, stretchy pull across the front of the shoulder and the pec. And what I want you to do now is just to take a deep breath in for me. And then as you exhale, you push into the wall a little bit more. Make sure you don't hyperextend the lower back. Good. See, it's very easy to compensate here. We want to try and get a bit of extension in the T-spine. So as well as stretching the pec, we're getting some extension in the thoracic spine, what we talked about before. So it's a great stretch that I utilize a lot. In regards to sets and reps, just holding this for 45 seconds to a minute is probably where you want to be looking at. But again, it just depends on the severity of your tension. If it's really painful, then lower that number and then gradually build up. If you did that 2 or 3 times in one sitting, it would be great. But with stretching, there's no normative data that says you should stretch this amount. The more you stretch, the better. But we're not just going to stretch the pecs in vain. We're going to try and activate and work the posterior chain straight after releasing some tension in the front. So we're going to engage the antagonist muscles, which are the mid and lower traps, and we're going to get those muscles to absorb the distance that we've gained from the front. All right. So we're going to go on to that stuff next. All right. So we're going to show you how we go about that. Okay, we've talked about the pecs and the mobilizing of the pecs, really important. Now we'll move over onto the spine itself. So we're talking about the thoracic spine. So this kind of region, all right? We've got the cervical in the neck, we've got the T-spine, the thoracic, and then we've got the lumbar sacrum. In this episode, we're going to have a quick look at the extension element of this, because in today's day and age, we're seeing a lot of people being very rounded in this part of the spine there, and they're locked into flexion, okay? This is due to ergonomic factors and also ways of the training. So the main thing we want to try and achieve is, instead of being flexed over, we want to try and gain some extension in the T-spine, but most importantly is not utilizing extension here. So you're not doing it from the lower back, it's coming from the T-spine. We need to get some extension in the T-spine. A lot of people are lacking in that area at the moment. If we can get some extension in the T-spine, everything should fall back and straighten up again. If we're flexed, a lot of structures like the shoulders can then fall forward and round into protracted look, just from kind of the way that you're positioned and gravity. So what we need to do is extend and get those shoulder blades back, allow us to sit straighter. All right. So I'm going to just demonstrate a couple of exercises now that are going to help to extend that part of your spine. Right, here we go. This is the Rockback. It's one of the exercises that are going to be really important in gaining that extension of the T-spine. All right, I'm going to just get my friend Tim here to be my subject. So, can you just go down onto your hands and knees on there for me first of all?
Hands and knees, yeah.
Okay, and we start in this position. So we've got hands underneath shoulders, knees underneath the hips, perfectly. So, first thing we want him to do is just round your back off here like an angry cat. That's what we don't want to do, all right? We don't want to do this. So first thing we do, we lower that down to the floor, all the way, inside your shoulder blades. There we go. Without bending the elbow, we keep this in. At this point, it's going to be difficult to not arch your back here. A lot of people will do that automatically. So what we need to do is just do a small posterior pelvic tilt. Again, so if you had a tail, tuck it between your butt cheeks. And by doing so, you're going to flatten off and stop this lumbar spine from arching in so much, okay? At this point, we've got a nice level tabletop. All right, and what we want to do now is just slowly start to rock back, nice and slow, like this. Every centimeter we go backwards, I want you to keep pushing this T-spine down towards the floor. So imagine you've got a chain at the chest and it's pulling you down to the floor, okay? Keep going. Every centimeter, nice and slow. Every centimeter we rock back. we push this T-spine down. We go into extension of the T-spine. Be careful we don't bring the neck too far up, so we then close the cervical too much, so nice and level there with the neck. So keep going back to the point where you start feeling a bit of like a dull ache and like a locked feeling in this T-spine. Are you feeling that, Tim?
I am, buddy, yeah.
Just in here, you should start feeling a bit of pressure.
It's nice,
especially if you're very rounded, you should feel a lot of pressure here because we're trying to extend the T-spine without the use of the lumbar spine or the neck. So it's very isolated. And then rock back up for me. All right, there we go. And then we start the process again. So we lower down, posterior tilt for me. Perfect, see how we're lying off there? And then we slowly come back, and every centimeter we push this T-spine down. All right, guys, that's the rock back for thoracic spine extension. Give that a try. Another exercise for you for thoracic extension, so T-spine extension. Again, I'm going to use Timbo. All right, I'm going to ask him to just turn and face the wall for me.
No problem.
And what I want him to do is put his hands onto the wall, okay? And then I want him to just step back a touch for me, all right? And then we're going to just sit back. So don't worry about the pelvis position. Just sit back, that's it. Keep going. Keep going, and then what we're trying to achieve here, we're trying to push this T-spine down towards the floor. So it's same as before, imagine there's a chain and it's pulling you down to the floor.
Got it.
What we don't want to do is arch excessively here or round excessively here. The main job is to extend the thoracic spine. In this exercise, we're also going to be opening up the pec and also the anterior delt. All right, make sure you don't creak your neck. All right, so keep your neck in neutral and just remember to push this thoracic spine down. All right, in this position, just try and round off like an angry cat, just this part of your back. There we go, and back down for me. Good. Feel that, Tim?
Yeah, totally.
And then back up again, and then down again. And now we can see that we're starting to mobilize this thoracic spine just there. All right, now you can have a stand for me. In regards to repetitions, you're probably looking at doing 3 sets of like 10 of those up and down, all right? But again, just feel free to do as many as you like and as many as you feel comfortable with, all right? Give that a go. Okay, so now we've got some pec mobility, so the shoulders are able to sit a little bit further back. We've got some thoracic spine extension. Now we're standing a lot better posturally and a lot more erect. So what's important now is to start strengthening and actually working and tightening the muscles of the mid and lower trapezius. These muscles are being used to being elongated due to the positioning of the scapula or the shoulder blade. When your shoulder rounds to the front, this goes that way. So muscles like the rhomboid that attaches at the medial border of the scapula and over onto the spine, they are pulled apart, so they're elongated. And also the trapezius muscle, which runs all the way up here. All right, so if they're in an elongated state, and have been for a long while, there's a possibility that those muscles are going to be in a bit of a dormant state or not functioning properly. So it's important to get some strength back in there and also to absorb some of the distance that we're now starting to gain from the mobility of the pecs, because we can't just stretch for the point of it. The antagonist muscle has to absorb some of that distance in order for you to really get the most out of your stretching. So one exercise we're going to show you next is particularly important in retracting the shoulder blades. Okay, and we're going to show you now. Okay, next one's the Cobra Stretch, all right? This exercise is mainly to stretch the upper abdominal area. If we start to slump forward, creating this rounded shoulder look, in order for us to kind of open up and stop shoulder injuries, we've got to be able to open up in this proximal abdominal area, all right? And this exercise is really good for that. So have a lie on your front down on the mat for me, please. Okay. All right, so just down like that. Okay, so hands flat on the bed. At this point, I just want you to just push yourself up, keep your hips down. So all the way up, and even like do a press up. There you go. That's it. Good. All right, and back down. Now bring your hands a little bit closer in. So there we go, and now do it again for me. All the way up. Can you feel that
I can
stretch?
feel that stretch, yeah.
All the way around the top part of his abs. All right. So again, enable him to stand better in a more erect fashion rather than being slumped. It's really important that we open up this abdominal area. Okay, give that a go, guys. Right, next one is the rotator cuff, massively important muscle groups. The main job of the rotator cuff is to stabilize the head of the humerus into the glenohumeral joint, which is the shoulder. So we've got infraspinatus, teres minor, and supraspinatus all alongside here, attached at the head, and externally rotate the humerus, so they round it that way. Okay, so when you see people that when they're walking, you can see the dorsal aspects of the hands, they're very rounded. If we externally rotate, you'll be seeing thumb first. And that's kind of where we want to try and get to in regards to posture. So the rotator cuff, again, is another set of muscles that are going to be elongated when you've got hyper activation of the pectorals and the muscles in the anterior side of the body. So infraspinatus, supraspinatus and teres minor, really important external rotators. There is also internal rotators of the rotator cuff which need releasing, but that's something that we can have a look at that in due course. For now, it's about working and strengthening those muscles because they're also going to be in a dormant state, are not functioning very well, and this is a massive cause of a lot of bodybuilders' shoulder problems. This is the root of it all a lot of the times, whether it's coming round the side of the shoulder or whether it's even in the trap area, upper neck, and even down into the front of the shoulder where the supraspinatus attaches to deep in here. So yeah, I'm going to show you one quick exercise that's going to be really effective at doing what we just said. So yeah, we're going to demonstrate it now. Give it a go, guys. Right, the rotator cuff. We're going to ask Tim to demonstrate today. So what I'm going to ask him to do is just place his hands through a loop. Today I've only got one of these bands at my disposal, but I'm going to show you anyway. Preferably if you get one of those loop bands that are attached, they're probably best for this exercise. So yeah, can you put your hands through there for me? And what I'm going to ask him to do is just turn around and face this wall on here. So we're going to bend the elbows and we're going to just walk in. There we go, perfect. So we're going to keep the elbows onto the wall. And what I want him to do now is externally rotate the arms by making the band go tight. All right. At this point, I want him to do little wax on, wax off. So little C's, so little circles, like half circles, so from in to out, yeah? But at the same time, I want him to start climbing, bringing the hands a bit higher up the wall, yeah? That's it, good. Remember, use the C, don't go directly up, use the C, that's it, good. By maintaining the tension of the band, we don't want to lead out with the elbow. It's all coming from the wrist and forearm. We should be working the rotator cuff right here. You feeling that?
I am, yeah.
On the way back down, you've got to go the opposite way. So the C comes back around the same path that it's taken to go up. Okay? All the way back. That's it. Keep that band nice and tight. And then back up again for me. There you go. Just little C's. Yeah? Good. Is that burning now?
It is burning, yeah. Definitely.
So what we're doing is externally rotating the arm. So we're working the rotator cuff, infraspinatus, supraspinatus, the muscles that we talked about before. Really important that we get some tension in those muscles and rejuvenate them and wake them up a bit, because if we're anteriorly protracted, so if we're rounded to the front, those muscles are going to be in an elongated state, potentially in a weak state. So this wax on, wax off exercise is a very basic, straightforward, really important exercise to strengthen the rotator cuff. So give that a go, guys.
Oh, I can feel that, guys, as well. Okay, guys, the second area we're going to go through today is the core and hips. Okay, a lot of people get issues with their hips, especially when they're doing squats and leg pressing. So Tom's going to go through some exercises now and explain why we get the problems.
Yeah. Okay, so one of the main areas we're going to talk about is the core. Okay, so we're going to start on that. So the core, big umbrella term, lots of muscles associated with the core, under the core umbrella, but we're going to just look at transverse abdominis and rectus abdominis to start with. So we've got, there's your rectus abdominis, we've got transverse abdominis just coming under here, yeah. The transverse abdominis' job is to just pull and suck everything in towards the spine. So sucking your belly button into your spine, okay? And all these muscles here, the lower aspect of the rectus abdominis and transverse abdominis attach at this pubic symphysis just there, all right? This joint there. The upper abs attach all alongside here at the sternum, and the lower at the pubic symphysis. So the upper section of the core is responsible for bringing the rib cage down into flexion, okay, and then the lower, as well as using the core in different ways, it's mainly used for posterior tilting the pelvis. So what we're doing is that movement. All right, so you're tilting the pelvis back. So if you can imagine yourself having a tail, you're just tucking that tail in between your butt cheeks. That sort of posterior pelvic tilt is exactly what those lower core muscles are responsible for, as well as bracing the core and acting like a corset around the lower back. Right, next exercise is a core exercise called the dead bug. Okay, I've got Tim to demonstrate. Let's go. Have a lie on your back for me. Okay. Head this way for me, please, Timbo. All right, so really good, important exercise, because what we're going to try and achieve is that posterior pelvic tilt. So remember when we were looking at the position of the pelvis, if the pelvis is too tilted to the front, everything else is going to round forward. So we want to try and tilt the pelvis back. Okay, so we're going to first of all do something that we don't want to do. So we're going to do an anterior pelvic tilt, which then creates a big gap under the lower back. Okay, so we want to do the opposite of that. So we're going to do a posterior pelvic tilt. So now we're going to tilt the pelvis. There we go. And now we should feel the lower back flat against the mat. I want you to engage your core muscles, so brace your core, suck your belly button into your spine. Don't hold your breath while you're doing that. Keep this on, all right? This should enable you to maintain this posterior pelvic tilt, okay? And now what I'm going to ask you to do is just raise your arms up to there, both of them. And I'm going to just pass you 2 3-kilogram dumbbells, all right? Perfect. So at this moment in time, is the core on? Okay. I want you to squeeze that as hard as you can, and I want you to lift one leg up at a time. Yeah. So 1 up to there. Okay. Just a bit lower, just like that. We don't want to be 90 degrees. Just there would be right. Okay. Engage as hard as you can, and lift the other one up as well. Perfect. Just to there. Now, without bringing knees forward, try and do a posterior pelvic tilt. So try and close the gap. Look at the shake. Here comes the shake. Keep that on. Keep that on. Now slowly go back with the arms. Slower than that. Slower. Go on. Go on. Throughout the movement, you're trying to prevent your lower back to falling into anterior tilt. So you need to ensure your lower back stays flat on the pad. Keep going. Keep going. All the way. All right. This is the very preliminary exercise. Now using just these, I want you to use these to pull the weights back up. Ready? 1, 2, 3, engage, and pull the dumbbells back up. You can see that shake on, it's quite evident to see. All right? All right? So now you can slowly lower the heels back down, okay? So there's definitely a dysfunction with Tim in regards to his deep core muscles, and Tim's a big, strong guy. So I've seen it quite a lot with bodybuilders that are very, muscularly defined in the abdominal area, but when we're looking deep into the core muscles that are acting like a protective mechanism for your lower back, we're finding massive dysfunctions, all right? Not so much massive with Tim, but he's definitely got a bit of a shake on, so he's got a bit of work to do. All right, this exercise can be, this exercise can be progressed quite a lot into like a Superman, but I'd probably just try and start off with the basic one that we just showed you there, and then as you get a bit more accomplished on it, you can then progress it. All right, give that a go, guys. Right, next exercise is the plank. The plank can be varied in many ways, and it's quite a simple exercise. Everybody knows how to do the plank apparently, but it's actually quite an art about it. So if you get this right, you'll feel it'll feel a lot harder and you'll get a lot more from it. All right, so what we want to try and achieve here is, first of all, we don't want to try and dominate the plank from the upper body and put a lot of the force through the upper body. So we're gonna lower the thoracic spine down into the bed. There we go, just as such. All right, are you comfortable there like that?
Yeah.
So we don't want to just hyperextend the neck or flex the neck, just release it. Okay, nice and neutral. At this point, I want you to do a posterior pelvic tilt again. So if you've got a tail, you're tucking it between your butt cheeks. All right. At this point, I want you to maintain this, and I want you to brace and engage the core muscles. So suck your belly button into your spine, keep everything on there. I want you to engage the glutes as hard as you can, like really fire them up, and at the same time, straighten the knees. 1, 2, 3, go. Good. Perfect. So at this point, I want you to keep this part of your back down, and I want you to keep your pelvis posteriorly tilted. So remember, hide that tailbone. You can squeeze the glutes and you can squeeze the core. These got a big shake going on now. All right.
More than normal.
So if you can do this, you can do the plank correctly, like he's doing, or you can do it in many other ways. You can round here, use all your upper body to keep yourself up there, or you can let all the pressure go onto your lower back by letting yourself arch like that. All right. So the key points here is thoracic spine extension and posterior pelvic tilt. All right, and remember to really engage the core as hard as you can and squeeze the glutes. All right, give this a go. That's the plank for you. Right, next phase we're going to look at is the hip. Lots of people downstairs in the gym and in bodybuilding world, they have problems with the hip. What a lot of people don't understand, that the hip muscles, or the gluteals in particular, when we're talking about here, there's quite a few. There isn't just the buttocks. There's a lot of deep structures, and each have different sort of jobs. And it's important to distinguish which is doing what, because then you can specifically target that muscle. When we're talking about the glute, we've got glute max, we've got glute medius, and we've got minimus. They're the three major ones. Then you've got deeper structures like the obturator returnus piriformis, which a lot of people would have heard of. Gemellus, the list goes on. There's quite a few, quadratus femoris. These muscles here, their main job is to externally rotate the limb, just slightly, just rotate the limb outwards. Okay, so bring the toes out if the whole leg is straight. The gluteus medius, his main job is to bring the leg out to the side, okay? So just out to the side like that, yeah? But he's also massively activated when you're standing on one leg. All right, so any exercise when you're on one leg, gluteus medius is on massively, okay? So we've got the deep ones that do that, the piriformis, the external rotation of the limb. And we've got gluteus medius, as mainly abducts the hip. So if you're doing a lot of sidestepping, you're hitting glute med. And then the single leg standing stuff, a lot of glute med. Gluteus maximus, though, he's one of the most lazy muscles, I would say, or unfairly treated in regards to kind of posture, because in today's world where everybody sits a lot, the glute is now becoming surplus to requirements, because it's just a cushion when you sat down. So as time's going on, these gluteal muscles are actually starting to deteriorate. So the gluteus maximus in particular, his job is to extend the hip, so bring the leg back. What I've seen from my experience is when you have a dysfunction in the gluteus maximus, you will have massive compensatory mechanisms occurring, primarily in the gluteus medius, so the one on the side of the hip here, so his brother muscle will be compensating massively, because instead of bringing the leg out to the back level, you'll be abducting the leg back. So you'll be using a lot of gluteus medius activation and not so much gluteus maximus. And also the external rotators will be working a lot more to compensate. Then we've got lower back, so the lower back erector spinae group, so muscles that run all the way along your spinal cord. Their job is to do, well, it does exactly what it says on the tin. It extends your spine. They will start to work more when your hip and your gluteus maximus isn't functioning properly, especially on the follow through of like a deadlift or a squat. You'll be doing a lot from your lower back. All right. Hamstrings is also a synergist for extension of the hip. So meaning synergist is a helper. You're supposed to be helping out. But a lot of the time, especially in my environment with football, we see a lot of problems with hamstring strains, and that's mostly related to a lack of gluteal function, which then the compensatory mechanism then put a little bit too much stress on the hamstrings in providing extension during sprinting, and then that's when you get problems. So if you are training as a bodybuilder and you're having really tight hamstrings, then you need to start having a look at why is that happening, and maybe your gluteus maximus isn't functioning properly in extension. So one thing we're going to do is show you an exercise for gluteus maximus that's going to be very, very difficult to learn, but however, once you get it, you'll feel your gluteus maximus light up like it never has before. It's going to be difficult to separate the overcompensatory mechanism, so it's going to be hard to switch the hamstrings off, switch the quads off, switch your lower back off. It's about regressing the exercise and really taking it slowly and feeling that contraction of the glute and getting that glute ignited and getting it working. And if we do that repeatedly, then the brain will automatically start to utilize that muscle a lot more. It is the biggest muscle in the body, massively powerful muscle, and we need to start utilizing it a little bit more, because if we don't and time goes on, we will end up losing the gluteus maximus altogether due to our sedentary lifestyle. Okay, so I'm going to just show you this next exercise. So give it a go. We're going to nip into the gym for this one, so we'll see you downstairs. The gluteals. When we said about the gluteus maximus, this one's a really good exercise in separating the glutes and trying to switch off certain muscle groups that are maybe compensating for the glute. So we're going to just demonstrate with Tim. This is called the wall glute bridge. Cool. All right, so have a lie down on there on your back for me. And then I want you to get your butt really close to the wall. So a bit more, there we go, perfect. So now we're going to put the feet up onto the wall. Can you creep this way a little bit more? There we go, so we've got to be quite close to the wall. So feet a little bit higher, just like that. All right, now, imagine you're trying to tuple over the wall, but you're only putting in a very slight, like 5% contraction into the wall through your feet, nice and evenly distributed. Now we're going to just start to roll the pelvis in a posterior pelvic tilt way. So by flattening the lower back against the pad, and also if we've got headlights at the front, we're trying to tilt them towards his face. So we're going to keep rolling towards you. That's it. Keep rolling, keep rolling, keep rolling. I'm going to start singing in a minute.
Keep rolling, rolling, rolling.
Keep going to a point where you'll be able to engage your buttocks. Now,
yeah,
have you got them?
Shake
now,
it.
perfect. Hold it there for me. So I want you to just keep tilting the pelvis and keep squeezing those glutes as hard as you can. I can see your quads are on massively there. Yeah? Can you feel them?
So, a little bit.
Little bit? They seem like they're really holding on.
Definitely glute.
Definitely feeling glute.
Definitely.
Okay, so just push through the heel very gently. That should switch the quads off. You got it?
Yeah.
So now it should feel a little bit more gluteal. And just hold that there for me.
That's really glute.
Feel it?
Yeah.
It'll really lighten up your glutes, this, and it's about isometric contraction, so you're just holding it without any movement, and it's about holding it for long periods of time. But if by him doing that now and applying different sort of pressure through the wall, he's able to switch off to the quads. So if you're a bodybuilder and you're doing big squats and big lifts and you can't switch off the quads, then you need to start working on posterior chain. So then you need to start finding ways to switch off those quads and engage in the glutes. This one's really good because you can push through the heel very gently, and that should switch the quads off. And by you keeping the engagement of the glutes, it should really light those up. All right, if you did this exercise before you did any sort of leg exercises, or any sort of compound movement like squats and deadlifts, you'll find a lot more activation coming from the gluteals than you would from anything else like your lower back or your hamstrings and quads. All right, how is that quad feeling? The glutes feeling?
Really working. Yeah.
They're really working, so they should be on fire right now.
Yeah,
all right, at this moment, we just very slowly start to roll the hips back down. That's it.
Yeah, oh, they've gone off now.
Segment by segment, that's it.
Yeah.
And then we repeat the process, all right? So the main aim is just to get the glutes firing, all right? This is a great exercise to do that, so give this a go, guys. The wall glute bridge. So yeah, the gluteus medius around this outer edge, you can see it just here. As you can see, it will slope into connective tissue right there. It will blend into this IT band that runs all the way down the side of the thigh, the lateral aspect of the thigh. You can see it right there. It's also blended into TFL, tensor fascial lata. So there's gluteus medius right there. All of these here are going to be really compensatory to the glute. So it's important that we stretch those muscles, but also work on the muscles that are dormant, that are not functioning properly, so we don't just constantly stretch for no reason. The IT band can pass all the way down and attach at the side of the knee. So if you're having problems with the side of the knee, it might not even be the knee, it might be the hip. That's where the problem is. Tensor fascial lata is a hip flexor, so it's bringing the hip up to there. Again, if you're sat down a lot, you'll find yourself in a hip flexed position. So these muscles are going to be on and tight for 8 to 10 hours a day, 5 days a week. They're going to be very dominant. So it's important to stretch this area out, as well as strengthening the posterior chain, which would be the gluteus maximus in this area. But the hip flexors is one of the areas that we're going to move on to next, because it is connected, and we need to just show you a quick exercise and how to stretch those hip flexors. So we've got rectus femoris coming right across here as well. Here's another muscle that does this action, and then the muscles of the psoas, so the deeper, you can't really see them very well here, psoas major and minor. They attach at the lumbar spine, so they attach at these vertebrae here, okay? So 1, 2, 3 and 4 of the lumbar vertebrae, and then blends into iliacus, a muscle in here, and then it comes over and attaches at this bony prominence just there. Their job is to flex the hip, just like that. These muscles are all going to be really tight, and could cause the back to be pulled down, so causing this hyperextension in a lumbar spine, and then everything falls forward, including your shoulders. So it's good to do all the work we've talked about in the upper back, but if we don't stretch the hip flexors and get them out of this anterior tilt and get them more of a posterior tilt where you can stand up straight, if we're stuck in this anterior tilt because of the tightness in the hip flexors that we've just talked about, then no matter what you do, you're going to find yourself in this falling forward position, and you're going to protract the shoulders as a result. So none of the stuff that we've talked about before is going to have an effect unless we get this hip region sorted first. So yeah, another point to look at is when you're leaning forward and everything's falling forward. If you're doing some running and your calves are on fire and they're always tightening up, a lot of gym goers are struggling with this issue. It's mainly because if you fall forward, you'll find yourself on your tiptoes, and then if you're on your tiptoes, you'll be overworking the calf muscle. So can you see how this pelvic region can if it's not in the right position, it can cause problems proximally and distally down the peripheral body, which can really cause injuries moving forward, especially if you're lifting heavy weights. So now we're talking about the hip flexors again. So we said about stretching those hip flexors. I'm going to just demonstrate, Tim, a very simple kneeling hip flexor stretch. So have a kneel down on there with one foot placed in front. Okay, so straight away, what we want to try and achieve, we want to get that posterior pelvic tilt into it. So we want to tuck that tail under. So if you imagine you've got a tail, tuck it in between your butt cheeks by tilting your pelvis back. By doing so, you should really feel the anterior aspect of the hip there being really tight all the way down the leg. Can you feel that?
I can, definitely.
Perfect. So in this stage, we just lift both arms up in the air, and I want you to reach really high to the ceiling, and then I want you to just bend to the side of the front knee. Okay,
Yeah,
so that way, a little bit more. There we go. And then can you open up this way for me? Keep bending that way. And you should feel that go creep up into psoas and the muscles that are attaching the lumbar spine that we talked about before. And we can hold this for about 45 seconds. Then we just drop the arms back down. Okay, perfect. And then we can just grab the heel. All right, and then we can lift. We can lift the heel.
I think about a bit too tight for that time.
Yeah, he's a bit too stiff for this one. Yeah, so the aim is to grab the ankle and pull up towards your butt, and that should incorporate a little bit of rectus femoris, so another hip flexor. Get this sock. There we go. So then we're hitting one of the hip flexors in the quad. It's really, it really brings that on. So by stretching these, it's going to really help you to have a neutral pelvic position, and it's going to prevent you from having to round yourself off, but leading from the hips. All right? So that's a kneeling hip flexor stretch. Give that a go, guys.
Good that. All right, guys. Well, thanks very much, Tom, for all that. Appreciate
You're welcome.
Help.
Anytime.
Okay. You guys have got a lot of information there to help you out of your whole your bodybuilding career or your exercise journey. Okay, if any of you do have a particular issue you want to speak to Tommy about, you can get Tommy on all the details below. Okay, and again, thanks for your watching. We've got loads of more videos on the website. We'll see you again soon.
See you guys.